Onions, a common staple in kitchens worldwide, are often overlooked for their medicinal potential. Yet beneath their pungent layers lies a rich array of bioactive compounds, particularly quercetin, a powerful flavonoid, and various organosulfur compounds that can offer substantial support to heart health. While not a miracle food, onions can play a quiet but meaningful role in reducing cardiovascular risk when incorporated thoughtfully into a balanced diet. However, as with any strongly active natural compound, onions are not without caveats, especially for individuals with sensitivities or existing digestive issues. Quercetin, abundantly present in red and yellow onions, is known for its antioxidant and anti-inflammatory effects. In cardiovascular terms, it helps neutralize oxidative stress, which is a key contributor to endothelial dysfunction, the damaging of the delicate lining of blood vessels. By reducing inflammation and improving the flexibility of arteries, quercetin supports better blood flow and helps lower blood pressure. Studies have shown that regular consumption of onions may lead to modest reductions in systolic and diastolic blood pressure, particularly in individuals with elevated levels. The sulfur-containing compounds in onions, such as allicin and S-L-cysteine, also have significant vascular effects. These compounds support nitric oxide production, which relaxes blood vessels and enhances circulation. They may also help reduce LDL cholesterol oxidation, a major contributor to arterial plaque buildup. When cholesterol oxidizes, it becomes far more likely to adhere to blood vessel walls, triggering atherosclerosis. Onion compounds appear to interrupt this harmful cycle, at least partially, by keeping LDL particles more stable and less reactive. Moreover, onions have been shown to possess mild antiplatelet activity, reducing the tendency of blood to clot excessively. This can be beneficial in preventing stroke or heart attack, particularly in people at high cardiovascular risk. But this benefit also comes with a warning. For individuals taking blood-thinning medications like warfarin, high onion consumption could potentially enhance anticoagulant effects, increasing the risk of bleeding. While this risk is small, it should not be ignored. Additionally, onions can cause gastrointestinal distress in some people, especially when eaten raw. They are high in FODMAPs, fermentable carbohydrates that can trigger gas, bloating, or discomfort in individuals with irritable bowel syndrome, IBS. These side effects, though not dangerous, can discourage consistent use in those who might otherwise benefit from their cardiovascular advantages. Cooking onions typically reduces these effects, but may also lower some of their beneficial compound levels. Still, the overall profile of onions is overwhelmingly positive when it comes to heart health. They are low in calories, high in fiber, and contribute key micronutrients like vitamin C, potassium, and B vitamins, all of which further support vascular function. Their benefits, while subtle and long-term, accumulate through regular use, making them a foundational part of any heart-conscious diet. In conclusion, onions are far more than a culinary base. They're a quiet cardiovascular ally. Their quercetin and sulfur compounds help reduce blood pressure, improve circulation, protect arterial integrity, and possibly reduce clot risk. But as always, the dose and context matter. Individuals with digestive sensitivity, allergies, or on blood thinners should moderate intake and consult a healthcare provider if needed. Used sensibly, onions can help support heart health naturally, layer by layer.